Myself, Dr. Humaira. I am from J.A.T. Arts, Science and Commerce College for Women. My topic is clearing agents. The After dehydration, the tissue is kept in a solution which makes paraffin to penetrate into the tissue. This process is called clearing, and the fluid used is known as clearing agents. The clearing agents should be miscible with alcohol to promote rapid removal of dehydrating agents from the tissue. It should be miscible and easily removed by melted paraffin wax. It should not produce excessive shrinkage, hardening, or damage of tissues. It should not dissolve out aniline dyes. It should not evaporate quickly in a water bath. It should make tissue transparent. So, such type of clearing agents are very much useful in the micro technique. The clearing agents which are commonly used are xylene. It is also called xylol. It is very good and true cleaning agent. It tends to make tissues such as brain and blood containing tissues excessively hard and brittle. Tissues should never be left in xylene for more than 2 hours. Biopsies and tissues blocks not more than 3 millimeter thick are cleared in 20 to 30 minutes. When dehydration is not complete, xylene becomes milky when section of tissues are immersed into it. Xylene is cheap and is usable when siloed in sections. It is highly inflammable. The next clearing agent is used in the form of the toluene. It is antimedia for routine work. Toluene is slower than xylene in action. Otherwise, in general, it is similar to xylene. It has practically superseded benzene because its fumes are less toxic. The next clearing agent is also used as a benzene. It has property very similar to xylene. It is not recommended for usage as it is known to be carcinogenic, hence it is not used commonly. The another clearing agent is used as a chloroform. It is the most ideal clearing agent for the central nervous system, tissues, lymph nodes, and embryos because it causes little shrinkage and does not harden tissues excessively. It is good for large blocks. It is not inflammable. It is not a classical clearing agent as it does not render tissues transparent and as a result its end point is difficult to assess. Dealcoholization time for tissues is 3 to 5 millimeter thick is 5 to 20 hours. Precautionary measures are necessary when handling chloroform as its vapors are toxic and anesthetic. It must be used in a well ventilated room and in a tightly closed container. It is relatively expensive. Another clearing agent is used cedar wood oil. Due to high cost and very slow action of cedar wood oil, it is rarely used for routine clearing purpose. It is very gentle and causes little or no damage to the most delicate tissues. It is ideal for research work, especially in the study of embryos. This reagent imparts proper consistency to dense fibrous tissues and skin tissues, which allows easy cutting of the sections. It also imparts transparency to the tissues. One major disadvantage is the difficulty in eliminating the oil from the wax oven. It must be noted that cedar wood oil clearing agent is different from more viscous type employed as immersion oil in microscopy. Besides these, the clearing agents that can be used but are not of great importance are carbon tetrachloride, carbon disulfide, paraffin oil, petrol, colloid, and methyl benzoate, which is used in conjunction with celluloidine for double impregnation of tough or fragile tissues. A number of proprietary reagents for clearing are commercially available. Most of them are cheap, non-toxic derivatives of good grade materials. One such reagent is histoclear. These reagents have shown good promises and may become very popular in future. So in such a way, for dehydration or after dehydration, the clearing agents which are used in the form of the solution is nothing but the agents which is helpful to penetrate the tissues and removing the shrinkage, hardening or damaging of the tissues. So such agents are called clearing agents.